As you know, our president, co-founder, and CEO, Jo Mousselli, is a registered nurse. Under Jo's direction, we have designed the FlashCure UV lash extension system to be safe and effective. It's going to revolutionize the way you do lashes. Let's get started. Thanks to Jo Mousselli being a registered nurse, safety is at the forefront of everything we do. As a reminder, please ensure you complete a thorough client consultation before each and every appointment. You can grab this paperwork digitally for free or purchase printed versions on our website. Always start with a pre-application consultation and end with aftercare instructions with every client and application. Begin your pre-application consultation using the Client Registration and History form to review your client's history. If your client is a candidate for eyelash extensions per the client consultation you conduct, then they will qualify to receive lash extensions using the FlashCure UV lash extension system with the following additional guidelines and precautions. As always, stylists should never apply extensions to clients who have obvious redness, swelling, open or closed sores on or in their eyes, or those who have broken or inflamed skin around their eyes. Clients who have recently had eye or facial rejuvenation procedures or surgeries must be fully healed and cleared by their medical or aesthetic practitioners. Examples of procedures include laser eye surgery, facelifts, and professional-grade laser treatments, such as CO2 lasers or deep chemical peels. Ask your client if he or she has any photosensitivities. If a client has a photosensitivity, it means the client may experience complications or severe side effects from being exposed to direct sunlight or artificial light. What can cause photosensitivities? Some medical conditions, topical medications, oral medications, and treatments can cause photosensitivities. Each client's photosensitive signs and symptoms will vary. Note that clients with identical conditions and medications may experience different signs and symptoms when exposed to light. Some examples of medical conditions that commonly cause photosensitivities include rosacea, lupus, conjunctivitis, and psoriasis. An example of a medication that can cause photosensitivities is tetracycline. Examples of topical products that can cause photosensitivities are retinoids. That said, if a client's photosensitivities are due to medications or topical products that they can temporarily abstain from using, then they can choose to pause their medications or topical products and receive lash extensions with light curing adhesive. If their photosensitivities are due to medical or cosmetic procedures, make sure they are fully healed before proceeding. As always, have clients sign the waiver and release form if they agree to continue with the application. If the client's photosensitivities result in severe side effects or complications, then do not use light curing adhesive. If they do not have severe side effects or complications, then have them consult with their physicians or medical practitioners before you apply lash extensions using light curing adhesive. If you and your client both decide to proceed with the lash application, make sure your client signs the waiver and release form. You may ask yourself, why can clients who have mild photosensitivities still receive lash extensions? Well, here's our rationale. 1. We keep the client's eyes closed during the entire procedure and we protect the upper and lower eyelids with UV blocking patches. 2. When used properly, our FlashCure UV lash extension light only emits a 1-inch cylinder of light straight down onto the client's UV-protected orbital eye area and lash line. 3. No other part of their face or body is being exposed to UV light. 4. Unlike the sun, which emits both UVA and UVB rays, our FlashCure light only emits UVA rays. It does not emit UVB rays. UVA rays are the gentlest form of ultraviolet light. Furthermore, to put the UV exposure into perspective, let's use an example wherein a stylist applies 100 extensions or fans per eye. Basically, 200 total attachments. During this application, you will flash the light a total of 200 times. Since with each attachment, you will only flash the light for 1/5 of a second on average, you've exposed your client to only 40 seconds of UVA rays. That's less than a minute. Compare that to the average time you spend in the sun with your eyes open without UV blocking glasses, during which your eyes are subjected to UVA and UVB rays. Even walking across the parking lot from your car to the grocery store takes an average of 3 to 5 minutes, during which you've exposed your eyes to 3 to 5 minutes of UVA and UVB rays. Moving on to the consultation and design form, it's important to document that the FlashCure adhesive was used, that UV blocking upper and under eye patches were applied, the UV light intensity setting that was used for the client during their lash application, and as always, please document your environmental temperature and humidity. Xtreme Lashes Lash Primer is a must during FlashCure lash applications, so note that you're using it in your documentation too. The Xtreme Lashes Eyelash Primer was created to balance the pH of your natural lash. This ensures the strongest bond with the longest lasting attachment, including with our FlashCure adhesive. Remember to always cleanse your client's lashes before beginning your lash applications. This step is essential to ensure the surface of the natural lash is free of residual makeup, sweat, and other debris, which will result in a strong and secure bond between the natural lash and lash extension. After cleansing, prime the natural lashes with Xtreme Lashes Eyelash Primer. Please note the FlashCure UV Lash Extension application system is intended for trained professionals only.